Good day, hello, good evening, good morning, depending on where you are on this fast forward planet. And I hope you're thriving as well as possible. There's so many layers of disruption. Some of it righteous and important. Some of it sweeping the world in ways that humans haven't figured out how to deal with yet. Some of it re-emerging after that initial pulse, as you can see here in the headline from the Miami Herald, which is not unique to Florida in any way. And this Friday session of Sustain What, which is a sort of a 3 or 4 times a week effort to dig in on solution paths amid what's emerging for societies all around the world, both locally and globally. Today is the news review, inspired by a cohort of longtime journalists and Wendy Wertheimer, who was a longtime NIH and WHO expert and analyst of these issues related to epidemic resilience and prevention. And today we're focusing on Miami because a special guest who's familiar to the panelists who put in touch with us is Hansel Tookes, who's an infectious disease focused physician at University of Miami's Medical Center. And we'll get into this, I'm sure, but what really impressed me was even in medical school, he was pushing for changes related to how do we limit risk from another pandemic that's still simmering and brewing all over the world in various places, HIV/AIDS. And he pressed for a law and it got passed in the Florida's first needle exchange. As far as I can tell, it's pretty much derived from your energy and enthusiasm. I'm sure there are others, of course, in the picture. And so we'll talk about all of this today. And first, I'm going to introduce, again, the panel. And we start usually with a little quick review of the headlines and the issues that you all have been thinking about through the course of this week. Every week is novel. You know, we had a 1,800 point drop in the markets yesterday. I don't know where it's probably rebound today. Everything has got that tumultuous effect. And there was this small matter of Black lives, which for the last 2 weeks has really reverberated in ways that are powerful and problematic around the world, around the country. And that's going to play out for a long time to come. So I just like to say hi to Bob Bazell, who was for many decades a fixture on NBC News, a chief science correspondent, still deeply immersed in these issues and teaches at Yale. Wendy Wertheimer, as I mentioned, who was at NIH for a very long time and at World Health Organization before that through the whole AIDS saga. And John Cohen out in surf country in California on the coast. And Hansel is here as well. Laurie Cohen. Laurie Cohen was a journalist I went to journalism school with. Laurie Garrett should be with us soon. We'll see. So let's just start with Bob. What's been on your mind as you track the headlines since our last session, which was on vaccines and all the issues around them?
Well, I think this enormous feeling of tension, excitement at the same time. Excitement over the possible success of at least movement in the right direction with the Black Lives Matter movement, but at the same time, a feeling of the virus's return and that sense of this never ending, and the weaponizing of public health in a way that we've never seen before, and it just surprises me more every day. So those are the things that I notice.
Can you give a tiny taste of what you're thinking of when you talk about weaponization of public health?
Well, we have all these threats of people who are contact tracers, the people who are speaking about the truth of the remaining danger who get shouted down. The idea that and we don't want to keep talking on the show, I know, about Trump all the time, but the idea of putting a waiver out for people so they couldn't sue if they attend his scheduled rally in Tulsa. They can't sue for liability if they get sick or die from COVID. It is an astounding thing that somebody would be given such a piece of paper, accept it, and sign it. What a bunch of craziness at once.
Yeah. Wendy, what's your week been like in that sense?
Well, it seems to me that there's always something that happens that kind of crystallizes everything for me. And last night, it was actually one thing that happened was Laurie Garrett was on MSNBC and talking about an OEDC report that shows that the world's economy is going to shrink and the United States economy is going to shrink. And that if we don't have a vaccine, as has been hyped and promised, it's going to freak people out even more. But then the thing that really touched me was this morning's, again, watching MSNBC, which probably contributes to my problems. The Reverend William Barber was on, and he was talking about what I can't breathe really means. And he said that I can't breathe shouldn't just be applied to police brutality, but that I can't breathe is about also the suffocation of our democracy, and that all of our institutions are being suffocated, whether it's the judiciary, the weaponization, as Bob just, I mean, the fact that there's a story today, I think I sent it to you, Andy, in the Kaiser News about public health officials, not just the contact tracers, but public health officials being threatened, right, quitting, being fired, sort of the undermining of the people we depend on to get us out of this mess. So I that notion of I can't breathe being kind of more universally applied to being careful and watching what's happening to our military, to the militarization of the police, to so many different institutions that are being harmed right now. And at the same time, a global pandemic, an election coming up. And so all of these things, they also talked about the next wave is going to be a wave of people not being able to pay their rent, of evictions and foreclosures that's going to contribute to homelessness. So it kind of brings it all back to people like Hansel, who are the true heroes in all of this and who are taking care of the people who are the most disenfranchised and caring for people who are at the intersection of whether it's AIDS and drug abuse and homelessness and COVID. All of these things are converging with a group of people who are taking on this immense task who should be revered. So that's what I'm thinking about.
Pretty powerfully articulated picture of the moment. Hansel, we'll get to you in a second. John, from your vantage point, John's been very dug in on the virus question, but of course on the whole landscape of challenges.
Yeah, I have a story posting in the next few minutes about the push for COVID-19 vaccine efficacy trials and what those are going to look like and the complexities of staging them. And two companies, this week, basically have said they're going to start in July. So one of them is going to be with the help of Warp Speed, the U.S. government program. So we're moving. It's June 12th. We are moving at warp speed. We are moving at a crazy speed, and the questions surrounding staging an efficacy trial are really complicated. And that's occupied a lot of my time speaking to people all around the world about how do you do this and how do you do it in a way that gets you the data you need, that's safe. Moving quickly, I've said this before, race car drivers crash, more than we do. So that's a big concern. Personally, I've had a really bizarre week because my house right now has all three of my children and my mother. My youngest child is 17. My mother is 90. And my 17-year-old's graduating from high school today. I'm going to leave on the hour to go to his drive-through high school graduation, which is bizarre in and of itself. And I have a 19-year-old, and the 17 and 19-year-old have been having backyard parties, socially distanced with a ping pong table and whatever. But the social distancing it's making me uncomfortable. Plus my mom is here. So all of it is really confronting this reality in a way that is new for me, because I'm letting down my guard at a time when California and San Diego is still hovering around 4% people testing positive, and the cutoff for opening up is 5%. So I'm in a pretty nervous zone in a moment. And then later this week, I'm going to, for the first time since this started, I'm going to take off 3 days and not do this and go on a road trip with my family to take my youngest son to see his new college, which he's never seen because of COVID. We never had a chance to visit the college he accepted. So it's my head is spinning from all of this. Right. And like lots of people around the country, I don't really know that what I'm doing is right. You know? Right.
Well, that's, by the way, that's a microcosm of the macrocosm of human experience right now. In the Anthropocene, these layers of complexity, whether you don't even think about, we didn't mention climate change, pandemics, as Laurie said long ago. And Laurie Garrett has joined us. I'm so sorry again about the technical issues.
I've been here for 10 minutes.
Well, here we are. We'll figure this out. What do you do when you don't know exactly what to do? And there are things that you can do. Doctors actually doing triage have to figure that out all the time. So Hansel, let's get a picture. You just came out of your rounds, 12 days or 14 days nonstop?
Well, today is day 12 of 14, which is, of course, why John wanted me here this day, because he would get the full raw Hansel experience. Wendy, your words are very, very kind. I mean, I would say that I'm just doing my job, but it is different now. There is a different sense of practicing medicine in the hospital. It's a different feel as you go in every day, and the patients are alone. They cannot have visitors, and that's even people who are in the end stages of life. So things aren't exactly the same, but we are still facing many of the things that we've always faced. Patients with AIDS who are admitted with pregnancy and an opportunistic infection, all of these things that are rooted in inequality and racial disparities that we see all of the time at our public teaching hospital here in Miami, Jackson Memorial. So some things are the same, some things are very different. In many ways, I'm very happy to have been going on this 12-day run, because I think that as a human and as a Black physician, I would have been home perseverating over the racial Armageddon that has occurred while I've been in the hospital. The last time I really checked in with it was when the president was, had his use of force in Lafayette Park, and at the time of his speech. And it was really, really concerning for me. I'd say the next day was the first day that I've actually been scared to wake up and get in my car and go to work for the first time in my life. So I've really been focusing on the job right now and participating in the White Coats for Black Lives demonstrations that we've had on campus. But when I come out of this after 14 days, there's going to be a lot of reflection on the world that I come back into.
At the same time, when you're poking your head out of the hourly, daily, weekly regimen of treating people and trying to run these programs that are minimizing risk for the least franchised among us, I guess is one. Is there some special resonance or thought that comes? Just describe that scene. The things you deal with that illustrate when you poked your head out, you were seeing this macro conversation about something you're actually experiencing. What comes to mind when you think about that?
So I think that one thing that's been really heartening for me is seeing the solidarity on campus, seeing the nurses and the techs and the physicians all together saying that Black Lives Matter. That's been very heartening to me in my practice, especially because we work in a hospital where the majority of patients are racial and ethnic minorities, but we still see the problems with mass incarceration. I mean, I have a very good relationship with the state attorney of Miami because she's been very supportive of the work that I've done. But, there were supposed to be decarceration efforts. And I have somebody admitted on my service right now with metastatic prostate cancer, cord compression. That means he's paralyzed and he's in the final stages of life, and he's shackled to a bed. And he was arrested for drinking in public, an open container, and burglary in a vacant building. So clearly two nonviolent offenses that happened 2 years ago. And I'm just in dismay that he could be shackled to the bed at the end of his life. So you see this perpetual, even though we're having all of these talks about criminal justice reform, that's not happening. And the Dream Defenders and FemPower, a feminist organization in Miami right now, are actually bailing him out so that he can be uncuffed in the final days of his life. So you know, everything persists as always.
That brings us to Laurie Garrett, who has been on this program a lot since the very early days. So, Laurie, you just were with Tony Fauci in some way or other. You have your finger on the pulse here, like no other person I know, in that sense of scanning the whole landscape. And what's on your mind that's most in the foreground right now that wasn't there maybe a week ago?
Well, I think that the Black Lives Matter, George Floyd protests are, spectacular. I'm stunned by the pace at which it has gained national acceptance. I can't even think of anything in my lifetime politically that has gained such a high level of general public approval in such a short period of time. It speaks to many things, one of which is what happens when cross-generational families are on lockdown together and have political debate, have political discussion, and take on issues so that the sort of indignation of youth blends with the wisdom of age and comes up with a more coherent way of responding. But I also have participated in some of the protests, and I have to say that I fled feeling unsafe COVID-wise. There's absolutely no social distancing. And while at least here in Brooklyn, while most of the young people are definitely wearing masks, as a person who's in a higher risk group by virtue of age, I just did not feel safe. It's interesting that very few police officers wear masks. It seems to be part of the same kind of attitude that is going to have an audience in Tulsa next week cheering on the president not wearing masks. It's as if somehow being opposed to Black Lives Matter, being opposed to this social dichotomous moment, is equal to also denying the existence of COVID and denying the need to protect yourself. And that is a sickening equation, one that most assuredly will take us down a path to hell. And I am really distressed about this, and I don't know a way around it. And one of the things I'm really especially worried about is I'm already seeing on the super right-wing social media declarations that they will greet contact tracers at the door with guns. And that if any contact tracers attempt to question them, it is their right to resist, even if it means shooting the contact tracer. And here in Brooklyn, I can tell you, most of the people getting hired to be contact tracers are people of color. So what happens when we have a dynamic where we've already said somehow supporting the president is denying the COVID threat and being anti-Black Lives Matter, and now we put in African-American and Latino contact tracers into the mix? This is terrifying to me. This is my big worry for the next 2 weeks.
Yeah, I think you're spot on, Laurie, on two fronts. One is about the intergenerational conversation, and the other is this racial tension is also going to be ramped up because as we do efficacy trials, we're going to look for the hottest spots, and that is going to take us to communities of color again. And what is going to be the reaction of people in communities of color? And Hansel, I'm curious what you think, being recruited more, harder than white people, simply because there's more disease transmission there that's symptomatic and available to see whether a vaccine works or not.
Yeah, I mean, there's so much mistrust in the Black community towards traditional healthcare systems. I mean, that's probably one of our largest challenges in HIV care, is busting through all of that stigma. I mean, John, you spent time with me here in Miami, and it's the pervasive stigma, particularly in the South, that causes a lot of the problems. But if you look at the COVID maps in Miami, they're the same maps as the HIV maps. They completely overlay the same as the homicide maps. Where I am right now, the life expectancy is 15 years less than where I actually live, which is a 7-minute train ride away. these sort of there's a reason that these communities mistrust the healthcare system, because we failed them in many, many ways. So I do have concerns about the vaccine trials and the uptake that they will have in the minority communities.
Yeah, and we were talking about that just a week ago with Heidi Olson, whose whole focus is on vaccine fluency. Larson, sorry.
Of the London School of Hygiene and Tropical Medicine, whose new book Stuck is just coming out.
Right, that's right. And I'm hoping to have her back on here again. And that this issue of cultural cognition, which I learned about 15 years ago, writing about climate change. And this gets back to a discussion I had with Laurie 2 months ago, when we were talking about what journalists need to know as they dive into the COVID-19 beat for the first time. And cultural cognition was this very well established concept that your culture, your biases, all of that completely filters how you look at information. And on climate change, though, it was all kind of wonky in the sense that it didn't have a direct impact on people's lives at any one moment, whether you reject some idea about climate change because of your culture. But here, as you're saying, when it's about vaccine programs or who comes to the door to collect just basic data, that creates a huge real-time impediment to progress. It's
actually, in the context of Miami, the very same neighborhoods Hansel's pointing out, the zip codes, are also where you already see, because of sea level rise, these fountains of water spewing out of the drainage systems. Because sea levels rising, you can even see fish and sea animals in the streets at high tide. So it overlays neighborhood by neighborhood, and then you add little Haiti into it, and the whole dynamic with the Creole speaking population. And I'm very, very worried about the confluence of these issues. What happens if a Cat 5 hurricane slams through the Gulf of Mexico or out of the Caribbean towards you, Hansel? And so this is the same at-risk population. It's an overstretched health system. You're already likely looking at a resurgence of COVID. And then on top of it all, FEMA is supposedly in charge of our COVID response. And FEMA, of course, would be in charge of an epidemic or a hurricane response, And then you have a denialist governor. Put that together for us. What does that look like if you're living in the African-American neighborhoods you're describing?
Yeah, so I went to college with Governor DeSantis, actually. We were at Yale at the same time. It's very problematic. The issues with climate change, and when you discuss the possibility of a hurricane hitting us, it gives me chills, because that's when we will fully devolve into madness. The approach that is happening in Miami to mitigate a storm is actually to build a wall down the city. This has all been buried in everything that's been going on, but the plan was to build like a 15-foot wall down the city, down the I-95 corridor, which would just add to the already very salient racial segregation that we have in this city, because it wasn't that long ago. When my mom grew up in this town, it was absolutely segregated. So the denialism about COVID that comes from the governor's office, the denialism about climate change. John knows that my husband and I are expecting a kid in October. We're going to have a little girl, and I cannot think of a time that would produce more anxiety as a future parent to have a child. What is this world that we're bringing this little girl into? It's very scary.
To get on to the point again about anxiety, which is I totally agree with that. I have a new grandchild, not a new child like you're about to have, so I look at it in the same way. But if you think about the mindset of a human being who is told that to be a member of a cultural group like a Trump supporter, you have to be opposed to the idea that COVID is a threat to you. That kind of cognitive dissonance must create enormous amounts of anxiety, and add into that the possibility of your home being destroyed by a hurricane, and there's not really any global warming or climate change. And it just puts people on such an edge They're out to kill somebody, and or be angry at somebody at the least. And this is only going to get worse and worse, because we all talk about it all the time, that as we get close to the November elections, there's a really strong possibility that the election is going to be canceled or denied. And there's just all these things that are coming together that I don't mean to just be crying wolf without any solutions here, but I find this to be the most frightening time I can remember. And I've been through a lot of times that I thought were frightening in a lot of places around the world.
That's because there's so many dimensions to the risks now, and they're all interlaced, and they all have uncertainty. The economics. I mean, there's a lot of certainty too. There's certainty that the economy is just beginning to retrench, and to what we've seen so far is not. It's the beginning of something much more profound that's going to happen, and we're all in some state of either denial or confusion. One thing that I wanted to look at as it lends on some possible pathways forward was Hansel's experience and getting that legislation passed in Florida. Now, obviously, AIDS is completely different than COVID-19, but somehow way up in Tallahassee, things happened that were important in Miami. Were there coalitions built? Was there crosstalk that recognized the common benefits of this? How did that happen?
So a lot of it, South Florida is much more progressive than the rest of the state. So it was building a coalition down here where we're most affected by HIV, and that included the state attorney that I was speaking of at the beginning. Many different organizations came together. That included Miami Police Department supporting the legislation because of their firsthand knowledge as first responders to the opioid crisis. I think that when we got the pilot in Miami back when I was a resident, it was sort of, finally we got the legislators to say, well, just let them do whatever they want down there in Miami, because we're sort of the other. But once people started to see the benefits of what we were doing in terms of reducing overdose and reducing HIV infections, we were able to get the expansion legislation passed last year. So now needle exchange is legal in the entire state. But even in that is another racial dimension. It was the changing face of the opioid crisis. If we were still talking about drug policy in the 80s and the way that we approached the crack cocaine epidemic versus the way that we approached the opioids, a lot of it had to do with changing demographics. We leveraged that, and we were able to make a huge advancement in drug policy. But a lot of it is coalition building. This has been. I've had so much support. I even have a Miami Police Department challenge coin here, because I've had so much support from law enforcement in the efforts that I've done. It gives me a lot of, I guess, again, anxiety right now, just to think about. I had another experience. I had a patient in my first week on service that called me in the middle of the night, who her son had died, and she was very distressed, and she thought that she was going to hurt herself. And my first instinct was to call the police to do a welfare check on her. And I called my social worker, who's a white woman in her 60s, and she said, "Oh no, don't call the police. Like, you have no idea what's going to happen." And I sat back and I said, "Oh my God, we can't call the police, because we don't know what's going to happen to this woman if we call the police." And that whole shift has just been, and it's always been that way. I guess I'm just really realizing it now. So, coalition building is great. I hope that all of these discussions that we're having, these intergenerational discussions, as you mentioned, will help find some common ground. But, to hear Bob even talk about the fact that we might not have a presidential election, or that the president might deny the results, I just don't know what sort of world we're living in anymore.
Hansel's team also works on the streets in some of the more dangerous, gritty parts of Miami, and they have a presence that is respected. And when I spent time with them, it was remarkable to me how loved they are. You guys are really appreciated by the most needy, discarded communities. The hated people, really, is, we call them marginalized in the world of science, but I think they're really hated. And your team is like a safe haven for them. When you get your van out there and you're doing your thing, they're not simply coming for medical service. They want your hugs. They want to see you guys, and everyone you work with is really deeply rooted and connected to the community. And I think that's part of the legislation change, is people saw it. You got media attention, you got my attention, other media, and they saw that this was really powerful.
Well, that relates to.
Can I ask you, so right on top of that?
Yeah.
I'll ask you something. I've been thinking really hard about what we could do to build on COVID in a way that does much of what you've done in Miami in the similar way. For example, since almost everybody who ends up with dangerous COVID infection has hypertension, and probably the cheapest, easiest test there is in the world is blood pressure, why isn't everything to do with testing, contact tracing, and so on also providing blood pressure testing and prescriptions for free medication to moderate blood pressure and nutrition referral for dietary interventions? In other words, we mentioned before, we had Heidi Larson here previously. One of Heidi's big breakthrough studies, which is like 25 years ago, was demonstrating that one of the root causes of vaccine refusal in very, very poor communities, not this stuff we see in the United States, but in parts of India, for example, is this attitude from the parents of, you only come here to provide healthcare when you want to stick a needle in my child's arm for something we don't even understand what it is. But when my child breaks his leg, there's no place to take him. When they are just running a fever and I don't know what it is, there's no doctor. And so her argument was, if we can't provide real health services, we can't expect buy-in for vaccination campaigns. Similarly, can we build on the kind of coalitions you're talking about and the kind of interventions you've already built for HIV? Can we build on that sort of a model for COVID so that on a scale up of days, not years, we provide the kinds of interventions that help people understand how to control their underlying comorbidities and lower their risk of dying of COVID if they get it?
Yeah, so we recently at the Idea Exchange, which is our syringe services program in Miami, we recently rolled out the COVID testing. So we do rapid COVID tests now. For a long period of time, we had interrupted services. We were no longer doing HIV and HCV screening, hepatitis C screening, because of the social distancing recommendations. But now we are doing rapid COVID screenings. And I'm listening to what you're saying, and the prevalence of hypertension is very high. Hypertension is a challenge because it's another one of those silent diseases. It doesn't get you till it gets you. So it's hard to convince people that they're sick when they don't feel anything. And there are additional challenges now in terms of, so John was talking about my team in the field, and my team is incredible. And it's been so beautiful to be in my apartment overlooking the bay, doing HIV care visits on telehealth under a bridge. And I'm so happy that we built the infrastructure to do that before COVID, because on day one, we were ready to keep it going. And that's been a beautiful thing. The issue is now we have these added dynamics of the disinfection and the COVID on surfaces. And I'm going to think about it, you caught me there with the blood pressure, because that's something that we could really catch, especially with the cocaine use and stimulant use that we have here in South Florida. We could likely make a meaningful change if we were integrating hypertension diagnosis and prevention and treatment. So that's definitely something that we should consider as we move back to opening up and getting back to the real world. But the syringe services programs across the country had huge service interruptions. So we did a survey, and almost 75% were no longer offering screening. So it's really going to be interesting seeing on the other side of this how many silent HIV and silent hepatitis C outbreaks occurred with these service interruptions in the future.
One thing that's so interesting about the way you're running your program, from my initial look at it, is it's a sensory system also, and that gets at what Laurie was saying about the multi-hazard approach. If the medical system is in the community, that provides vigilance and potential awareness as well as intervention. It reminds me, this will be weird maybe, but in India, I spent some time a couple of years ago working on indoor air pollution, burning biomass and cooking pollution, a huge toll on public health. And I got to know they have this system. There's 1 million women in villages across India who are accredited social health activists, ASHA, and they're from the communities. They have they have a phone, and they're connected to local clinics, and they're there to monitor for when a woman is of childbearing age, making sure she gets in prenatal care if she's pregnant and the like. And it felt like, I've looked into literature on it, it's kind of this sensory system and trust building at the same time. And when you think about that, even in the context of what's the discussion around defund the police, your interactions with the police, whether you call it defund the police or get beyond that hashtag into the more meaningful sort of ecosystem approach to risk reduction and well-being, it feels really promising. And I don't know whether, is there a big gulf between where you're at with that aspect of setting aside needle exchanges specifically, but that public health question in areas that are underserved, and thinking about the ASHA model, or is there a frontier here that is worth exploring?
I mean, I will say, when I went onto service time is a blur. We all know that. So about 4 weeks ago, when I went into the hospital, I had to rewear an N95 mask, and I had to rewear a shield, and no longer could wear my cool clothes. But I had to reuse personal protective equipment. And then these protests occurred, and I saw what Miami Police Department was wearing. It looked like it was out of a science fiction movie. I couldn't believe that the Miami Police Force had all of that personal protective equipment, yet in the hospital where we're serving the community, where we're serving a majority minority population, we were just scraping by with the bare minimum of personal protective equipment. And that sort of inequity in funding is just unacceptable. I mean, how are we supposed to adequately care for people when we're not protected? And it was really hard seeing the extent to which the police had their equipment. There is also a huge divide that occurs. I'm very fortunate that I'm able to do telehealth with my patients who are under a bridge. That's because my team goes out and is able to do that. But there is a divide that we see in terms of access to telehealth and these services, and people who are, poor but have a home, but they might not have a smartphone and they're not able to access Zoom. So we're going to have to work really hard to even address things like the digital divide in order to continue to deliver healthcare in a meaningful way to vulnerable populations.
Yeah, in many ways. Sorry.
Because really good point, because here in New York City, despite a totally liberal governance structure and so on, they just revealed data that shows that 9% of the school children in New York City that are told to be in homeschooling have no access whatsoever to computers or the internet. So that means that 9% of our children will have lost a whole year of school, essentially, and fall back, say, to second grade over again, that sort of thing. That's horrible. And that's just a pure class divide.
And so I'm curious about something we talked about here a couple of weeks ago, and it's the confluence of narratives of Black Lives Matter and COVID-19, and why this moment rose to such a high level to take, police brutality against Black people. Come on. Why did this, and yes, this was a horrific video that everyone saw. There was no disputing anything about whether this man was murdered or whatever. But why? How do you see it, that these things combining to take the issue somewhere beyond where it's been before?
Yeah, I really think that a large part of it is just divisive leadership at the top, I will say. I won't say a lack of leadership, because I think that the president's very effective in doing what he does, but it's purposeful, divisive leadership at the top. We've never seen anything like that before. In college, I remember September 11th, and everybody knows Yale's a very left-leaning and liberal school, but we still turn to President Bush for comfort and for unity during that time. I have never seen anything like the nightmare that we're living in now. And I think that it is that divisive leadership from the top that has made this as horrifying as it is.
And look at what's happening next week. It's all going to come together because the president is going to hold a mass rally in Tulsa. And you look at the latest Tulsa COVID data, and it's doing this. It's almost a straight line, right, of new COVID diagnoses. Meanwhile, it's going to fall on the anniversary of the 1921 massacre, the largest massacre of African Americans ever carried out in the United States, and of a particular African American community that was called the Black Wall Street. It was the most affluent part of the United States post-Civil War Black economy. And it is as much of a wink, wink, I'm with you, to the Klan as I have seen since his famous, there's good points on both sides statement about, was that Charlottesville. And I think next week we're going to see the specter of, thousands of white people marching without masks into their stadium or whatever this facility is to hear the great leader. And no one's going to have masks. And I'm sure he'll say denialist things about COVID. He'll insist the economy is booming. And if he says anything at all about George Floyd and Black Lives Matter, it will be to say we need stronger police, something of that nature. All issues are coming to a head. You spoke before about coalitions. All issues coming to a head is both terrifying, but it also means can we see a moment where these different forces of opposition come together, so that those in public health that are saying masks, the need for mitigation and so on, come together with those saying stop violence in the streets, stop police slaughter, and those now bringing in the conversation about social determinants of ill health and loss of education and so on. What do you think, Hansel?
It's horrible to say, and as a physician, I always want to do no harm, but it's going to take a lot of them getting sick, and a lot of them are going to get sick. And when it happens to them, they will see that this whole, it's so easy to put on a mask. This whole obstinance and just refusal to listen to public health because the great leader is flouting mask wearing. I mean, it's just, I think that I really do feel that a lot of them are going to get sick. And I think a lot of people are going to get sick from the RNC in Jacksonville. And I think that when they know somebody or they themselves get sick, maybe they'll look at this pandemic in a different way.
I wanted to add, and I don't want to keep referring to my family here, but in the other room, my 32-year-old daughter, who works for an organization on behalf of women of color who are incarcerated, keeps pointing out that as bad as the police are in the United States, and as we all acknowledge that it is, she says, you cannot think of this as a police problem only. You have to think of it as a problem that involves prosecutors forcing people to take plea bargains all the time, not giving people a chance for a trial. You have to, and she's working now on getting women released and imprisoned people generally released because of COVID. Their strongest allies have been the family members of the prison guards, because the virus is going out of many prisons around the United States into the communities, with the prisons being accelerators as much as nursing homes and meatpacking plants are. So it's a very good idea, Laurie, to start thinking about coalitions, but sometimes you have to look in places where you wouldn't normally think to look, such as family members of prison guards being on your side in terms of letting incarcerated people who are in for often very minor offenses or just for not making bail, letting them out. And then there needs to be follow-up so that they get services of the kind we've been talking about. So yes, this is a great time to start thinking about a lot of things, even though, to repeat my point, we're all feeling a lot of pressure because this idea of there not being an election, this idea of what Laurie was talking about next week at Tulsa, that's all been written about. These aren't conspiracy rumors. These are things that are appearing in the Atlantic and the New Yorker and all kinds of places about these enormous amounts of dangers that we all face right now.
So Hansel, I have a question for you. Do you have any questions for journalists as you consider the landscape of what you see? What are we not doing? Does that feel like an issue to you or an opportunity when you've seen the coverage even of the needle exchange or other things you've worked on, except for John's fantastic stories about your work? What comes to mind? Is there a lost opportunity in how journalism is approaching things like this, or is it, what feelings do you have in those lines?
And this is the same thing that we saw with the election. So I get to read fantastic journalism. That's what comes through my feed because that's the way the algorithms work. And what I see is very compelling. The Tulsa Juneteenth situation was laid out as clearly as possible. But the problem is that that's what I see, and what the people who watch. What's that fake news network that exists now? The
OAN.
Oh my gosh! Like when I put that on, it's if I don't know what I'm watching. I don't know what world I have turned on in television. And the same thing with Fox News. I think that journalists are doing the work, but unfortunately, there's such a hyper focus on whatever. I go to MSNBC. I will admit I'm part of the problem. I watch MSNBC, but I do flip through Fox News because I just want to see what they're saying. Mostly so I can yell at the TV. But yeah, I think that's the problem. I wish that the news weren't filtered through these complex algorithms so that we could all get a sense of what's out there.
Yeah, it's something I've been focusing on a while. In the climate arena, there was a coalition that came together. It's climateaction.tech, climateaction.tech. It's people working in that arena at the big companies, Facebook, Google, and the like, who are tired of not having a moral code in how they code. Like, should there be an ethics to those, an ethical? You're never going to get a rule, but can there be some way to tip the designer systems so that they're not taking us to the lower part of us, so that they're connecting, they're not doing exactly what they're designed to do now, which is to activate you. It's like validate you, piss you off, or just deeply distract you. That's what they mainly do. And this is a grand challenge right now. And I think that's why I started this initiative at Columbia. And it's not at the journalism school, because this is bigger than journalism. It's at the Earth Institute.
The interesting thing, I want to ask Wendy something, because back in the day when HIV was first emerging in the 1980s, it wasn't wacko journalism that was putting out disinformation. It wasn't some far fringe stuff. It was mainstream media that was either totally deciding to ignore the story because, hey, it's homosexuals, right? Or we're distorting the story in ways that, to use the overwrought term John previously used, marginalize the marginalized. Really seem to make the patient demonstrators, the ACT UP activists, look like Looney Tunes. And the big exceptions are the people on this screen. I mean, Bob was doing things at NBC that were fantastic at a time when some of your competitors on the other networks were portraying the AIDS problem in, let's just say, really hideous ways that almost encouraged what happened with burning down the homes of boys with hemophilia who got HIV in the blood supply. Wendy, from your vantage point at that time, you were in government. And you're looking out and you're saying, where's the New York Times? Where's the Washington Post? Where's CBS? How did it seem when we weren't talking about, as Hansel mentioned, a divided media stream? Everybody watched Walter Cronkite then.
Exactly. Everybody there was one nightly news show. There was the Today Show. John wrote a story once a week. You wrote stories on a regular basis. Bob was on every night, but I think there were conspiracy theories then. There was the whole AIDS denialism and Peter Duesberg, but there wasn't this social media ubiquitous all the day long craziness going on. And there wasn't state media as there is now, as Hansel said, of two news organizations that totally seem to exist to support the president. So I think it was different. I think we had time to think. We had time to write a press release, actual press release, and there were embargoes on scientific information. it wasn't, I don't know, John, you may disagree with me, but I feel like so much now is science by press release and putting things out every second rather than the science building incrementally. But I do agree that there was such a stigma on people who were infected. But I think the time that changed, and we've talked about that, is when we kind of brought people with the infection into our midst to help us design science. And Hansel, it occurs to me too, I went to NIH to start the Office of Research on Women's Health. And the whole idea was that women were not being included in clinical trials, to look specifically at their issues, but also just in clinical trials in general. The same for minorities. NIH set up an Office of Minority Health to try to do something to approach the kind of mistrust and stigma that existed, and to make AIDS clinical trials more inclusive. One of the ways we did that was also to do trials at a community level, not just in academic health centers, but to do it and I mean, it makes me so sad to hear what you're saying now. And what Laurie is saying is, how are we going to make these trials inclusive to benefit the people who are most at risk, but at the same time not abuse people or that's a bad word, take advantage of a community. That we're in our trials in Africa, people did, as Laurie said, we were sort of helicopter science. You dropped in to do a trial and then you were gone. And so all of this is, I don't know, Hansel, what do you think it will take to bring communities to want to be included in these kinds of trials, which, as Laurie also has pointed out, aren't necessarily going to work. So I'm just curious what you think we could do to ever change that dynamic. And if all of what's happening now is helping to point out the huge disparities. I mean, the question I was going to ask her is, do you think that the press is covering that enough? The huge disparity that exists in healthcare across the board for minorities, and how that is going to contribute to increasing COVID and increasing HIV and increasing homelessness and increasing drug abuse. And is it time we start facing that too?
I mean, absolutely. These are systems that have been put in place, and this dropping into communities and doing trials and then going out. One of the biggest things that we've realized during COVID, apart from the horrific racial disparities in terms of both infection and death, is that a lot of the way we deliver healthcare system, there are structural barriers that have been man-made and put in place. That's particularly applicable for HIV care. John saw how hard it was for me to get a patient into HIV care from the street back when he was in Miami. Now all of those barriers have been removed. You don't have to have an ID. You don't have to show up anywhere. You don't have to sign anything. They've all been removed because of the pandemic. And I just hope that this progress that we've made in making low barrier access to care, I hope that we have that on the other side, and they don't go back to you have to initial these 18 forms and go to this side of the county and the other side of the county, because all of that's gone right now. And we have to make sure that if we're going to remain in communities, that we don't bring these huge impediments back to the healthcare system.
So there's one element here before we end. I would love to have Hansel have you explore, which is what you can offer through your experience when you were a student to those who now across campuses in America, after we had the shutdown academia day, one day, now it's open up STEM, open up academia. And what's your message to those who are coming through the pipeline now, whether they're going into medical school or social work? We're going to do a session on here in a week with a professor from our social work division at Columbia on community engagement, innovation, and the likes. And you were a student when you pushed for this needle exchange. That's just one example of what can be done at the student scale. And I tweeted about this the other day. So what are we doing now to open up STEM, to open up academia, to have impact along with the learning that we do? So we have only we have about 6 minutes left, and that gives a little time after you say something to have a final word from everybody here. But what's your manifesto for the next Hansel or Gretel?
My resident was named Gretel when I was just on service. It was quite a hoot. But the thing about it, the students keep us honest. The students keep us moving on the arc towards progress. A lot of them think that I'm becoming, a little bit too mainstream as I've worked to softly and gently navigate the political climate. But they keep us honest. We have a very interesting situation at the University of Miami. Our dean is Black, which is incredible. There are very few medical schools that have a Black dean, and it's the best time to have a Black dean and to have a leader, to hear him speak as we all knelt for 8 minutes and 46 seconds in the quad was an experience that I'll never forget. That's the picture that you put on the flyer. And Dean Ford has been an incredible leader. And we just, as academics, I have to remember I wasn't a student that long ago to support these students. And they don't think we're doing enough in terms of solving racial inequities, even within medical education. And we just have to remember that we have them, we have to support their voice because they are pushing us in the right direction. It's sort of the same reason that in everything in HIV, we include people who are living with HIV in the design of our studies and programming. And the same thing for drug use. You want to have people with lived experience because they keep us honest as we're doing this work. The students are the reason that that's like my best benzodiazepine to treat my anxiety. They let me, I have faith that things are going to change and that things are going to get better. But it's important for us to take time to hear their voice and to support it moving forward.
Do you have do you have the capacity to have time to do that? You're teaching medicine, but you're also doing medicine. Are there classes in that, or is there a way to ingrain that into what everyone is learning?
Interesting thing about the University of Miami, and I know we're coming up towards the end, many schools, the thing that they want to be famous for is their fancy cancer research and vaccine or something like that. We've realized that our strength comes in the community that we serve. The fact that we have this incredibly diverse community, this complete diversity of infectious diseases and this confluence of the social determinants of health, poverty, racism, and all of that. And as we move forward designing our new curriculum here, we're making sure that all of our students and all of our graduates know that zip code is as important as whatever genetic mutation you're talking about. And so we're getting it in the complete medical education. And the fact that they're letting people like me teach should show that that is occurring.
I want to say
awesome.
something hopeful. I think we're in a moment of what evolutionary biologists call punctuated equilibrium. And that's when the volcano erupts and the lava goes down one side of the mountain and kills everything there. And the other side of the mountain survives, not because of survival of the fittest, but just because of proximity. And we're at this moment of punctuated equilibrium where we're seeing things potentially dying off that are bad. Our bad pandemic preparedness is one of those things. And the racial issues we have, I hope we're seeing hatred and the horrible police behavior all around the country that's been videoed again and again and again. This isn't one incident. I mean, all of us every day are glued to these video incidents. And I think we're seeing that punctuated equilibrium moment. And to just circle back to this other question about media, we've all turned into wire service reporters. I began my career loving the fact that I worked at a weekly where I have one story a week. It was great. I could think and really do, what Wendy said earlier, take the time to digest and process and think. Now I'm 24/7. And that's the huge shift in journalism for, I think, all of us. We're all on all the time now. And that creates a very different mindset about what a story is and how we narrate. And that's the big challenge. When I did a story about Hansel, I had time, right? We spent time together. I wasn't rushing. The story didn't appear for a couple of months afterward, I don't think, and that kind of journalism is critical to really telling the true stories.
And the new model of journalism that can be more present, which is how do you shape a better conversation? when I was blogging at the New York Times. I was a reporter. I did magazines first, then books, then the New York Times, then the internet. And to me, building an effective conversation that engages the whole community, meaning people who are not on the internet, even though you're on the internet, that's a grand challenge, but that's also an opportunity too. And the arc of the story is your journey more than a particular piece of literature. And that can be, I think that's what we're trying to do here. We're at the end of this hour. Laurie and Wendy, if you have a particular last word to sneak in. I know, John, you have to go to another thing, and then I'll just close things.
The only thing I would just say very quickly is yesterday I was part of a conversation at the Council on Foreign Relations that's online on the CFR website about what history tells us about pandemics that may be useful in thinking about where we're going with this one. And if there's any big take-home lesson from the historical record on pandemics, is that pandemics bring forward all the social inequities in societies. They point up the flaws, the weaknesses, the vulnerabilities of societies. And you either come out of that pandemic resolved to fix and address some, if not all of those things, or you come out of that pandemic into John's punctuated equilibrium with the survival of the fittest and to hell with the rest. Mm-hmm. And if you go through the history of pandemics, I mean, even if you only go back as far as 1347 and take it through the plague and then forward, you see very clearly that what forces play out in the early stages socially in a pandemic dictate which of those two options ends up being the outgoing end of the pandemic. Meaning, if there are attempts, as we see now, to address our number one American classic problem, racism and the legacy of slavery, if there are attempts now to address those, we have hope to believe that when we come out the other end of this pandemic, we will have fundamentally transformed some of those structural issues. And that's maybe the positive take-home message.
Wendy, do you have a last thought for the week?
I think Laurie summed it up perfectly. All I'd say is no justice, no peace.
Inclusive justice. Yeah, that's a key thing.
No hell.
Hansel, it was great to have you join
our
merry band, and great for everyone always to be part of this. Sustain What is a global online conversation identifying solutions to the complicated, shape-shifting, and epic challenges of humanity's great acceleration, which is what scientists defined our moment as a few years back. Of course, now we're in a great pause. And as Laurie explained, these junctures can change us in profound ways in one direction or another. And that depends on how everyone acts at this moment, outreach or moving inward. A prime focus is making sense of and getting the most out of the planet's fast forward information environment. It's the one Earth system changing faster than the actual environment. The webcast is produced as part of my work building Columbia University's new Earth Institute initiative on communication and sustainability. The question is, how do we make information and conversation matter? And I think this conversation mattered. So tune in, lots coming here this week. And next week, we'll be back to discuss the sort of the media and information environment around these issues. Thanks again to Hansel Tookes from the University of Miami for being on. Be safe, honor those who are in greatest risk, and work hard every day. Take care, everybody.
See y'all later.